Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving deep into a topic that affects countless furry friends and their devoted human companions, canine atopic dermatitis. It's a frustrating, chronic condition, and our goal is to shed some light on its complexities, drawing on the latest research and insights to help you better understand this multifaceted disease.
You're absolutely right. Canine atopic dermatitis, often referred to simply as atopic dermatitis, is universally recognized as one of the most common cutaneous inflammatory and pruritic, or itchy, diseases in dogs. It's fundamentally a genetically predisposed inflammatory and itchy skin disease. What makes it particularly challenging for veterinarians and owners alike is its multifaceted and chronic nature, necessitating a tailored therapeutic approach for each individual dog rather than a one-size-fits-all solution. This condition is remarkably prevalent, affecting anywhere from 3 to 15% of the general canine population, and astonishingly, it accounts for up to 58% of all dogs presenting with skin diseases. The age of onset typically spans between 6 months and 6 years, though it's notable that over 70% of affected dogs develop their first clinical signs specifically between 1 and 3 years of age. While atopic dermatitis can affect any breed, many have been associated with a predisposition, with terriers, retrievers, and brachycephalic dogs being most commonly affected. For example, studies have suspected a breed predisposition for English bulldogs, and breed-associated phenotypes have been reported in breeds like West Highland White Terriers, Shar-Peis, and German Shepherds. The pervasive impact of this condition extends far beyond just the physical discomfort for the dog. The relentless scratching and persistent secondary infections can create a significant strain on the human-animal bond, sometimes leading to overwhelming frustration for owners, to the point where dogs may unfortunately be relinquished to rescue shelters or even euthanized. Therefore, early intervention and consistent, compassionate management are not just beneficial, but absolutely crucial to slow the disease progression and ensure a good quality of life for these beloved pets and their families.
That's a powerful and empathetic beginning, highlighting the real-world impact. It's important for our listeners to grasp that canine atopic dermatitis isn't a simple, single condition. In fact, it has recently been suggested that it should be classified more accurately as a syndrome rather than a well-defined, singular cutaneous inflammatory entity, a concept also gaining traction in human atopic dermatitis. This concept of a syndrome truly highlights the enormous diversity in clinical presentation and response to treatments that we observe among affected dogs, driven by genetic factors, the extent and stage of lesions, and the presence of secondary infections. The clinical signs themselves can be quite varied, but typically involve chronic skin inflammation, intense pruritus, or itching, and recurrent skin infections. Dogs might present with generalized pruritus that can be seasonal, such as with pollen allergies, or non-seasonal, common with dust mites or food sensitivities, or even non-seasonal with seasonal worsening. On examination, you'll frequently observe erythema, which is redness of the skin, along with primary skin lesions like papules, pustules, crusts, and excoriations, the latter being self-induced lesions from persistent scratching. The most commonly affected anatomical areas typically include the head, specifically around the mouth, eyes, and ears, the flexor aspects of the elbows, the carpal and tarsal joints, the paws, including digits, claws, and interdigital areas, the ventral abdomen, perineum, and the ventral tail. Adding to this diagnostic complexity, there's also a specific variant known as atopic-like dermatitis, or ADL. This condition presents with clinical signs that are identical to classical atopic dermatitis, but crucially, it is characterized by the absence of demonstrable immunoglobulin E, or IgA, antibodies erected against typical environmental allergens. This key difference means that allergen-specific immunotherapy, which relies on identifying these specific IgA antibodies, cannot be effectively formulated for dogs with atopic-like dermatitis. While the true incidence of atopic-like dermatitis remains unknown, studies in different regions have found it present in a notable percentage of dogs diagnosed with atopic dermatitis, further emphasizing the condition's diverse presentations.
That comprehensive look at the clinical picture truly reveals the intricate web of factors at play. Delving deeper into the why, the pathogenesis of atopic dermatitis is remarkably complex and not yet completely elucidated. It's a dynamic interplay between both intrinsic genetic predispositions and various environmental factors that ultimately shapes the dog's immune response and triggers the development of clinical disease once a certain threshold of inflammatory response is achieved. Classically, The process is thought to initiate with sensitization to environmental allergens, such as house dust mites, which predominantly penetrate through the skin. This penetration leads to the crucial recruitment and activation of resident inflammatory cells and the degranulation of mast cells, typically via binding to immunoglobulin E. Once activated, these cells unleash a cascade of inflammatory mediators, including various pro-inflammatory and type 2 cytokines and chemokines, which then collectively determine the course of the disease. Interestingly, as the lesions become chronic, there's often a shift or predominance of a type 1 inflammatory response. A critical, undeniable element in this pathogenic process is a defect in the epidermal barrier. This impaired skin barrier, whether it's a primary genetic flaw or secondary to ongoing inflammation, allows for significantly higher penetration of allergens, which in turn profoundly exacerbates the inflammatory response. Recent, cutting-edge research highlights the crucial and surprisingly active role of keratinocytes, the cells that form the primary skin barrier, in orchestrating the overall immune response. These cells are now understood to be far from inert physical covers. They actively produce and release key cytokines and chemokines, such as thymic stromal lymphopoietin, or TSLP, and interleukin-33, which give pivotal signals that shape how dendritic cells process antigens and the subsequent type of lymphocytic immune response generated by cutaneous contact with allergens. Beyond allergens and barrier defects, other major factors can significantly worsen the condition, including bacterial infections, particularly with Staphylococcus pseudointermedius and fungal infections, commonly caused by Malassezia pachydermatous, along with various psychogenic and environmental factors such as humidity.
That insightful look at the underlying mechanisms truly demonstrates the intricate nature of canine atopic dermatitis. Given this profound complexity, the diagnosis of canine atopic dermatitis is indeed not straightforward. It relies heavily on the presence of characteristic clinical signs and, critically, on a thorough process of excluding other pruritic diseases that might clinically mimic atopic dermatitis. It's crucial to emphasize that there isn't a single pathognomonic clinical sign or a definitive diagnostic test that alone confirms this disease. Instead, the prevailing approach involves a systematic, four-step process designed to meticulously identify and address underlying causes of itching and common flare factors in atopic dermatitis. This diagnostic strategy comprises three distinct, yet complementary, approaches. First, systematically ruling out other skin conditions with clinical signs resembling or overlapping with atopic dermatitis, what's often referred to as the workup. Second, a detailed interpretation of the dog's historical and clinical features, often guided by established clinical criteria like Favourite's criteria. And finally, specific allergy testing. It's absolutely crucial for practitioners and owners alike to understand that relying on any one of these approaches in isolation can easily result in misdiagnosis. For instance, a persistent bacterial or yeast infection, or even a subtle parasitic infestation, can dramatically influence the perceived overall level or distribution pattern of the dog's pruritus, effectively masking the underlying atopic disease. Therefore, the first and most fundamental part of this diagnostic workup involves employing basic sampling methods and diagnostic tests to confidently rule out most of the common differential diagnoses. These routinely include flea combing, comprehensive skin scrapings, careful hair plucking, and detailed cytological examination of both skin and ear samples. This thorough initial investigation is essential because, unless these other conditions are meticulously ruled out or effectively managed, it becomes impossible to accurately diagnose or appropriately treat atopic dermatitis.
That emphasis on a comprehensive rule-out process is absolutely critical. So, let's unpack those foundational steps in more detail as they lay the groundwork for any successful atopic dermatitis management. Step 1 involves meticulously considering the possibility of fleas and flea allergy dermatitis. Even if direct visualization of fleas is difficult, as it often is, these tiny parasites are a tremendously significant and common cause of pruritus, and a substantial number of atopic dogs can also suffer concurrently from flea allergy dermatitis, which inevitably complicates the overall clinical picture. To effectively exclude fleas as a confounding factor, a rigorous and effective flea control program, applied consistently to all other animals in the household, is indispensable. This program should be maintained for at least 3 months prior to any definitive allergy investigation or study enrollment to ensure that fleas are unequivocally no longer contributing to the dog's itch. Next, Step 2 expands this parasitic focus to other ectoparasites beyond just fleas. This includes sarcoptic mange, chilidialosis, pediculosis, trombiculiasis, and otoicoriasis, or ear mites. These conditions can be notoriously difficult to clinically distinguish from atopic dermatitis because their signs often overlap, and, importantly, some mites, such as Sarcoptes scabiei, can even produce antigens that cross-react with house dust mites on allergy tests, leading to confusing results. Diagnostic methods involve various types of superficial and deep skin scrapings, hair combings, and ear swabbing. Given that some mites, like Sarcoptes scabiei and Chalidiella species, can be particularly elusive and challenging to find, a therapeutic trial with an appropriate antiparasitic treatment may be necessary to definitively rule out their involvement. Moving on to step 3, we address the ubiquitous bacterial and fungal infections. Staphylococcus pseudointermedius pyoderma and Malassezia pachydermatous dermatitis are exceedingly common secondary issues in dogs with atopic dermatitis, frequently exacerbating the itching, inflammation, and discomfort. Cytological examination of skin and ear samples is the most rapid and effective way to identify these organisms and confirm their presence. Crucially, treating these secondary infections is not merely symptomatic relief. It's a vital diagnostic step because it allows veterinarians to clarify the true extent and specific distribution pattern of the underlying atopic dermatitis once the complicating microbial factors are removed. Finally, step 4 centers on cutaneous adverse food reactions, or CAFR. Food-related pruritus can present clinically in a manner indistinguishable from atopic dermatitis, or it can act as a significant flare factor in dogs already diagnosed with atopic dermatitis. For any dog presenting with year-round clinical signs of pruritus, a strict elimination diet trial, rigorously followed for a minimum of 8 weeks, is the only reliable way to definitively rule out cutaneous adverse food reactions, as commercial allergy tests for food are not currently considered accurate or dependable. This is an especially critical step, particularly for dogs with non-seasonal itching, as those with food-induced atopic dermatitis may not respond favorably to typical allergy medications targeting environmental allergens. Only once these 4 comprehensive steps are diligently and successfully completed, and pruritus unequivocally persists, can a confident clinical diagnosis of canine atopic dermatitis be made.
That systematic approach provides an incredibly clear and logical pathway for accurate diagnosis, truly highlighting the importance of elimination before confirmation. Once a clinical diagnosis of canine atopic dermatitis has been established through this rigorous process of exclusion and careful interpretation of clinical features, allergy testing then enters the picture to identify potential causative allergens. It's absolutely crucial to reiterate that these tests are not screening tools for the diagnosis of atopic dermatitis itself, but rather specialized tools primarily intended to guide the formulation of allergen-specific immunotherapy, also known as ASIT. The 2 primary methods employed are intradermal testing, or IDT, and allergen-specific IgG serology, or ASIS. IDT involves injecting minute quantities of various allergens directly into the skin and carefully observing the localized skin reactions, and it is often considered the preferred diagnostic method by many veterinary dermatologists. However, ASIS, which measures the levels of circulating allergen-specific immunoglobulin E antibodies in a blood serum sample, offers several significant practical advantages. It requires no patient sedation, is considerably less traumatic, more convenient to perform, and carries a lower risk of interference from concurrent anti-inflammatory or antipruritic medications that might skew IDT results. Despite the differences, it's worth noting that the long-term success rates of allergen-specific immunotherapy based on either IDT or ASIS results are not statistically significantly different. Both testing methods, however, are still in need of greater standardization across laboratories, which unfortunately can lead to issues with false positive or false negative results. It's estimated that between 10 and 30% of dogs with a clinically confirmed diagnosis of atopic dermatitis may inexplicably show a negative IDT result. This high percentage of apparent false negatives can be attributed to various factors, including improper testing technique, using allergen concentrations that are too low, the aforementioned drug interference, intrinsic host factors that affect skin reactivity, incorrect selection of local allergens, or even performing the IDT too long after or during the peak allergy season. It also includes the presence of atopic-like dermatitis, where an immunoglobulin E response simply cannot be documented. Regarding medication interference, certain classes of drugs, such as antihistamines, systemic glucocorticoids, and even some sedatives, are known to interfere with IDT results, necessitating specific withdrawal times before the test can be reliably performed. In contrast, drugs like ketoconazole, essential fatty acids, cyclosporin, and oclacitinib appear to interfere considerably less with IDT. For allergen-specific IgA serology, interference from most medications is generally less of a concern. It is also vitally important to emphasize once more that neither intradermal testing nor allergen-specific IgA serology is considered reliable or recommended for diagnosing cutaneous adverse food reactions, and a stringent elimination diet trial remains the universally accepted gold standard for that specific diagnosis. The proper interpretation of these complex allergy test results, when combined with the dog's extensive clinical history and detailed presentation, can be quite challenging and time-consuming, which is precisely why a referral to a veterinary dermatologist is frequently recommended for optimal interpretation and management.
That's an excellent, nuanced explanation of allergy testing and its appropriate role. Once a firm diagnosis of atopic dermatitis is established, the focus unequivocally shifts to comprehensive, lifelong management, recognizing that this is a chronic and progressive disease that is not curable. The treatment plan must be exceptionally customized for each individual dog and their unique owner circumstances, a key point emphasized in current guidelines. This personalization takes into account various factors such as the severity of clinical signs, the ease of treatment administration, potential side effects of medications, the owner's financial circumstances, and their overall expectations for their pet's quality of life. The overarching goals are clear: to maximize the quality of life for both the pet and the caregiver, to support and protect the invaluable human-animal bond, and to effectively reduce allergy flares while simultaneously minimizing the cost and potential adverse effects of medication and the complexity of treatment regimens. The strategic approach to treatment typically revolves around 4 core factors: addressing the chronicity versus acuity of lesions, managing pruritus, controlling inflammation, and treating infections. Providing immediate relief from itching and inflammation is always the paramount first step, as owners are unlikely to adhere to complex long-term strategies if their dog remains uncomfortable. Topical therapies are a fundamental and indispensable component of managing atopic dermatitis, particularly for improving skin and coat hygiene and care. These include various moisturizers, such as emollients and humectants, which primarily function by increasing water content in the skin, reducing transepidermal water loss, or TWL. This increased hydration alone can significantly reduce pruritus and the need for other antipruritic drugs. Anti-inflammatory and antipruritic topical agents are also crucial, with new-generation glucocorticoids and calcineurin inhibitors being considered the most effective topical anti-inflammatory drugs. New-generation topical glucocorticoids, like hydrocortisone acetonate, are particularly advantageous because they are metabolized in situ into inactive molecules, dramatically reducing the presence of systemic side effects compared to older, less selective formulations. Calcineurin inhibitors, such as tacrolimus ointment and more recently investigated topical cyclosporin formulations, have shown considerable promise for treating localized atopic lesions with minimal systemic side effects. Additionally, skin barrier repairing agents, including topical essential fatty acids, ceramides, cholesterol, and plant-derived sphingosines like phytosphingosines, are increasingly utilized as adjuvant therapies. These products are designed to normalize the epidermal lipid lamellae and restore the skin barrier, addressing a critical underlying defect in atopic skin. Studies have consistently demonstrated that some of these agents can significantly improve clinical signs, reduce cutaneous inflammation, and enhance skin barrier function, further highlighting their importance in a comprehensive, multi-pronged treatment plan.
That's a fantastic articulation of the holistic and topical strategies. Beyond topical applications, systemic therapies represent a critical and rapidly advancing pillar in the management of canine atopic dermatitis, directly targeting the complex underlying immune dysregulation. One of the most impactful developments in recent years is oclacitinib, a specific Janus kinase, or JK, inhibitor. Oclacitinib rapidly gained immense popularity almost immediately after its introduction due to its remarkably rapid action combined with a favorable safety profile and generally few side effects. Mechanistically, it preferentially inhibits Janus kinase 1 and Janus kinase 2, which are crucial for the signaling pathways of many pro-inflammatory and pruritus-inducing cytokines, such as interleukins 2, 4, 6, 13, and 31. This targeted inhibition explains its significant effectiveness in reducing itching, often within 24 hours from administration, with further clinical improvement evident within 7 days. Comparative studies have shown oclacitinib to be as effective as prednisolone, a commonly used glucocorticoid, for controlling pruritus and clinical signs associated with allergic dermatitis, while notably acting much faster than cyclosporin, another established systemic drug. Its impressive safety profile, even with long-term use, makes it a valuable and often preferred alternative to other immunomodulatory drugs routinely used in veterinary dermatology for adult dogs. Another groundbreaking systemic option that has garnered increasing popularity is locavetimab, which is a caninized monoclonal antibody specifically designed to target and neutralize interleukin-31. Interleukin-31 has been confirmed as a key cytokine in the development of early skin lesions and is critically involved in canine pruritus. By recognizing and binding to naturally produced interleukin-31, locavetimab effectively makes it unavailable to bind to its receptor and trigger the itching cascade. This innovative approach results in a significant decrease in pruritus, typically within 1 to 3 days, and an improvement in clinical signs after only 7 days following a single subcutaneous injection. Clinical field trials have extensively evaluated the long-term efficacy and safety of locavetimab, showing it to be effective and safe with mild side effects, even when administered at monthly intervals for 9 consecutive months, and it has been shown to be clinically equivalent to cyclosporin. Finally, cyclosporin, a calcineurin inhibitor, has been a cornerstone of atopic dermatitis treatment for the past 2 decades and is widely recognized for its high efficacy and minimal side effects, often serving as an excellent glucocorticoid-sparing agent. It exerts its therapeutic effects by decreasing T-cell activation and suppressing the production of various inflammatory cytokines. While consistently proving clinically beneficial, recent studies have indicated that cyclosporin may have limited direct effects on altering skin barrier function, lymphocytic subpopulations, or the cutaneous microbiota in atopic dogs. These profound advancements in systemic treatments collectively underscore a significant shift towards more targeted therapies that precisely interrupt the itch and inflammation pathways in atopic dogs, providing more effective and often safer options for long-term management.
The innovation in systemic treatments is truly remarkable, offering more precise and safer avenues. Beyond these established and emerging pharmaceutical approaches, there's a continuously expanding field of research into alternative therapies for canine atopic dermatitis. The motivation here is often to find more natural compounds with fewer potential side effects, or to reduce the overall reliance on the core immunomodulatory medications like glucocorticoids, cyclosporin, or oclacitinib. A prominent area of investigation has been probiotics, with particular attention to specific strains such as Lactobacillus rhamnosus, Lactobacillus paracasei K71, and Lactobacillus sakii probio, 65. Studies have consistently suggested that the careful administration of certain probiotics can be beneficial in preventing the development or reducing the clinical signs of atopic dermatitis, and potentially lessening the need for other medications. For instance, early exposure to Lactobacillus rhamnosus in a canine model demonstrated profound long-term clinical and immunological effects, even showing structural benefits related to skin barrier function. Oral vitamin E and vitamin D supplementation have also shown encouraging results, reducing clinical signs in moderate cases of atopic dermatitis after 8 weeks of treatment, with reports of increased circulating vitamin levels and, importantly, a lack of reported side effects in both studies. Other intriguing alternative treatments explored include procaine, utilized in neural therapy, which has been associated with significant reductions, over 80%. In clinical signs and pruritus, with maintained improvement observed for many weeks after the last injection. The novel application of ultra-pure soft water in conjunction with a specialized shampoo has also demonstrated a notable decrease in clinical signs, pruritus, and transepidermal water loss in dogs with moderate atopic dermatitis over a 4-week period. Furthermore, a combination of pentoxifylline and polyunsaturated fatty acids has proven effective in reducing both clinical signs and pruritus, with the combination showing greater efficacy than pentoxifylline alone. Even naturally occurring bioactive lipid compounds known as endocannabinoid-like compounds, specifically ultramicronized palmitoylethanolamide, have been investigated in affected dogs, leading to significant reductions in both clinical signs and pruritus, accompanied by an increase in the dog's quality of life. However, it is essential to maintain a realistic perspective. Some alternative approaches, such as cold laser therapy, homeopathy, and fluoxetine, have shown limited or questionable efficacy in studies, and others, like mazatinib, have been associated with moderate to severe side effects, warranting caution. Despite the potential and promise of many of these alternative approaches, allergen-specific immunotherapy remains uniquely positioned as the only treatment for atopic dermatitis in dogs that appears to have the potential to normalize the dysregulated immune response and thereby actively slow the progression of the disease itself. While this therapy requires a significant commitment, often taking 6 to 12 months before improvements become evident, and is not universally effective when successful, it can profoundly reduce the lifelong need for other anti-inflammatory medications, offering a long-term disease-modifying benefit. The intricate interpretation of allergy test results for immunotherapy and its subsequent long-term management demands specialized experience and skill, which is why consultation with a board-certified veterinary dermatologist, especially one with expertise in allergy immunotherapy formulation, is often recommended for optimal outcomes.
That's an incredibly thorough exploration of both alternative and disease-modifying therapies, and it truly brings us to the cutting edge of veterinary dermatology. Looking towards the horizon, the future of canine atopic dermatitis treatment is undeniably geared towards even safer, more effective, and increasingly targeted compounds, with particular excitement surrounding the development of new biologics. The vision is to provide a truly customized medicine approach where treatments specifically target the unique molecular pathways and mediators relevant to an individual patient's clinical subtype of atopic dermatitis. While locavetimab currently holds the distinction as the only biologic approved for dogs, it is entirely plausible to anticipate the availability of many more biologics in the near future. This might include, by analogy with human medicine, monoclonal antibodies targeting other critical interleukins, such as interleukin 4, 13, 17, and 22, which are currently under evaluation for human atopic dermatitis, as well as anti-immunoglobulin E and anti-interleukin 31 receptor antibodies. Given the inherent complexity and heterogeneity of atopic disease, it's even conceivable that instead of a single monoclonal antibody, future therapeutic strategies might involve cocktails of monoclonal antibodies designed to simultaneously address multiple dysregulated pathways, thereby potentially increasing overall therapeutic efficacy. Researchers are also actively exploring other novel avenues, such as viral particle-associated cytokines and bacterins, as potential treatments for allergies in animals, with variable but promising efficacy and mild side effects. Beyond specific drug development, a critical direction for future research lies in refining our diagnostic and prognostic capabilities. This includes leveraging genomic studies to develop predictive algorithms. Such algorithms could eventually allow clinicians to identify dogs at high risk of developing atopic dermatitis early in life, proactively select interventions to potentially prevent disease manifestation, precisely design highly effective treatment programs tailored to an individual dog's specific genetic underpinnings, and even predict the likelihood of success or the risk of adverse effects associated with different treatments. A crucial methodological shift advocated for future studies is the inclusion of control groups with other non-atopic inflammatory skin diseases, in addition to healthy controls. This comparative approach is vital to truly discriminate which molecular or cellular changes are specific signatures of atopic disease versus merely manifestations of nonspecific, broad inflammatory responses. Furthermore, a key and increasingly recognized area for intervention will be the modulation of the microbiome. Restoring microbial biodiversity on the skin is now understood to be profoundly crucial for proper immune system function and maintaining a healthy skin barrier, which in turn can help minimize the vicious cycles of new sensitizations and further barrier disruption. Ultimately, the overarching message remains consistent: canine atopic dermatitis is an extremely complex clinical syndrome. The most successful treatment approach is a multimodal one, meticulously customized for each patient, striving for a balance of high efficacy, minimal side effects, and manageable costs. Treatment options should be regularly reassessed and adjusted based on the specific and evolving needs of both the patient and their dedicated owners.
Thank you for listening to the Veterinary Medicine Digest. The titles for the reference papers are in the video description. If you're enjoying this, remember to like, share, and subscribe, as proceeds from this channel go directly to providing vital veterinary care for animals in need. Even a small amount can transform an animal's life and ease an owner's burden. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.